Hi, I'm Dr. Parvati Raghavan, and in this Dental Basics, we are going to learn the order in which nerves are blocked following local anesthesia. The topics covered include the classification of nerve fibers given by Erlanger and Gasser, their functions, proprioception and what it means, how the diameter of an axon influences the conduction velocity of a nerve, which type of fibers are blocked during local anesthesia for dental procedures. To understand this video better, you should know a little bit about the structure of motor and sensory neurons. For this, you may want to watch my video on the nervous system. You should also know how impulses spread in a myelinated and unmyelinated nerve. This is given in part 1 of the video about nerve impulse generation and conduction. Functionally, there are two types of nerve fibers, and both have different basic structure. Sensory fibers are efferent. They carry sensations like smell, taste, touch, etc. and arrive at the central nervous system. Whereas motor fibers are efferent and exit the CNS with information to muscles to control our actions and movements. Erlanger and Gasser classified peripheral nerves as Group A, which are 1 to 20 micrometers in diameter with an average conduction speed of 100 meters per second to and from the central nervous system. Group B have a diameter of 1 to 3 micrometers and average speed of 3 to 14 meters per second to and from CNS. Group C fibers are 0.5 to 1 micrometers in diameter with the slowest average speed of 0.5 to 2 meters per second. Group A fibers are heavily myelinated. Group B fibers are moderately myelinated. We can remember them as B4 Bolt fibers. Usain Bolt's world record speed run was 9.58 meters per second. Group C fibers are unmyelinated and sensory. Group A has 4 subdivisions. They are 1 alpha, 2 beta, 3 gamma, and 4 delta. These delta fibers are important from a dental point of view. They conduct fast first pain, which is sharp and localized. They also conduct sensation of temperature and firm touch. The fast pain pathways carry the signals that trigger our withdrawal reflex within a few milliseconds when we receive a painful stimuli. Group A fibers have both sensory and motor function. Alpha fibers are somatic motor and muscle proprioceptive. Beta fibers carry light touch, pressure and proprioception. Gamma, touch and motor proprioception. Difference between motor and muscle proprioception is that each muscle contains many motor units. These subdivisions have different amounts of axon thickness and myelination. Alpha are thickest and heavily myelinated. Beta are thin and myelinated, gamma thinner and less myelinated, delta are the thinnest and least myelinated. Now, you have been hearing a lot of this word proprioception. So, what is proprioception? Let us find out. Proprioception is a circle of feedback between sensory receptors present throughout our body and our nervous system. Proprioceptors are specialized sensory receptors located within joints, muscles, and tendons. They are sensitive to tension and pressure. Example, sensory information like the stretch in our muscles and the changes in our joints that occur when we move are sent to the CNS so that our body knows when and how far to stretch our legs when we walk or run. When we eat, our brain analyzes different textures and hardness of the food in our mouth to provide the best chewing strategy. Masticatory forces and rhythms are developed based on tactile sensory feedback from the food's contact with the teeth and soft tissues in the oral cavity. We are easily able to sense a small piece of stony granule while eating rice. Many of us have experienced this, and this is due to proprioception. Group B fibers are general visceral efferent, GVA. They are also preganglionic autonomic sympathetic fibers. GVA are sensory. They carry pain or reflex sensation from internal organs, glands, and blood vessels to the CNS. Important for us dentists are the group C fibers, which carry sensory messages to the CNS at a slower speed. They conduct slow second pain, which is a long-lasting, non-localized ache. They also conduct temperature, touch, itch, and postganglionic autonomic sympathetic fibers, that is, fibers from the ganglion to the effector organ. A very good example of the sensation carried by activation of C fibers is the hot sensation of chilies. Whether A or B or C fibers, they're all made of axons. When the diameter of the axon is more, there is increase in 1, the thickness of the surrounding myelin sheath, and 2, increase in the distance between adjacent nodes of Ranvier. This is good because it causes more rapid saltatory conduction. Larger diameter axons and more myelination cause faster impulse propagation. The A, B, and C fibers transmit signals at different speeds. Also, time taken by the LA to block A, B, and C fibers vary. Conduction velocity is highest or fastest in alpha fibers because they are thickest and heavily myelinated. As shown by the arrow, the velocity falls down further as the axon becomes thinner and less myelinated. It is the slowest in unmyelinated C fibers. The time taken to block these fibers is just the opposite, with longer time being taken to block alpha fibers. And as shown by the arrows, time taken to block beta, gamma, and delta becomes lesser and lesser, with C fibers being blocked fastest due to the absence of myelin. In myelinated nerve fibers, the myelin sheath insulates the neuron pharmacologically and electrically. Pharmacologically, LA can't pass through the myelin sheath. The pharmacological action of LA is only at the nodes of Ranvier. Electrically, because the ionic changes that develop during impulse conduction also occur only at these nodes of Ranvier. If conduction of an impulse is blocked at one node, the local current will skip that node and raise the membrane potential at the next node to its firing potential, producing depolarization. It is therefore important that at least 2 to 3 nodes which are immediately adjacent to each other are blocked by LA. A length of nerve approximately 8 to 10 mm should be blocked for effective anesthesia to occur. Conclusion is that saltatory conduction is fast and more energy efficient. The ability of a given local anesthetic to block a nerve depends on the diameter of the nerve, the presence of myelination, the length of nerve exposed. Fibers blocked first, the autonomic fibers. They are tiny, rapid firing, and most sensitive. Sensory second, and somatic motor last. They send voluntary commands to skeletal muscles. For dental procedures, the trigeminal nerve branches are anesthetized. They are small, rapid-firing sensory fibers. Only the mandibular branch has motor fibers. It is mixed nerve with both motor and sensory fibers. The sensory fibers can vary in diameter as well as firing rates. We have been using this word firing a lot. So firing means how fast a single neuron connects to other neurons. Pain fibers fire fastest. Pain is blocked first by LA, then temperature, touch, and in the last pressure. Significance is due to this order of blockage, patient may feel pressure even though pain fibers are completely anesthetized by the local anesthetic. Taste sensation is also blocked in the following order: Bitter taste is blocked first, then sweet, followed by sour, and finally salty. That's all for now. Thank you for watching. Do leave a like, subscribe, and share.